My name is Danae Bartke, and I am the Executive Director of HCU Network America. Thank you to everyone who is joining us. Tonight, we will be discussing the low protein diet. Specifically, oh boy, there's a interventional and medical diet survey on the RareX platform. So our conversation is kind of based around that. I'm joined tonight by Amber Gibson and Samantha Stallings. And so, ladies, would you like to introduce yourselves?
Do you want me to go first, Amber, or do you want to go first?
I guess I'll go ahead and go. My name is Amber Gibson. My daughter is Samantha Gibson. She's 7 with Homocystinurias. She was diagnosed with a newborn screen. And basically, this type of, like with the RareX and the studying and all the research that they're doing is so important. One, we know how to take care of this type of condition and give the best care that we possibly can, but also to further ahead, move forward in medical research so that there is a way to either make it easier to control or work our way to possibly maybe even finding a temporary or even permanent fix for it. So that's what I find important about medical research for this condition. She has classical homocystinuria, so she has to have the formula along with her medications and the proper low protein diet.
And I'm Samantha Stallings. I'm in Kentucky. I have classical homocystinuria as well. I was actually not diagnosed till I was 24. Back in 92 in Kentucky, the newborn screening did not have homocystinuria on it. And so I was missed for approximately 24, by the time I got the test back, 24 years. So I do take formula. I'm a low protein diet. I think research is important just because, as Amber said, trying to find maybe a cure or something along those lines. I have 2 rare diseases. And so the research even helps with the clinical trials and stuff, because I'm not allowed to do a lot of the clinical trials for homocystinuria because it may affect my other disorder.
Wonderful. So, being that you were a parent, Amber, coming into this, and Samantha, can you guys talk a little bit about your relationship to food prior to the diagnosis? I know for myself, I was diagnosed at 10, and by 10, you have a pretty good understanding of the world of food and all the things that you like and dislike. So maybe you guys could share a little bit, starting with you, Amber, what your relationship with food was like before your daughter, Samantha, being born. Could you share a little bit?
Yes. I didn't know much about it before she was born. About a week after she was born, a newborn screen caught that her homocysteine levels were high. And then we had her retested, they were still high. And then from there, we had to wait until we could see the metabolic doctor. So with that, they just had us do normal feedings until we got into the metabolic doctor. And then they had us alternate between breastfeeding and the specialized formula for her. So we had to alternate with that. And then once we got the full diagnosis and we got the understanding about, okay, she's going to be a formula her whole life, she has to have this low protein diet. And once you start to realize exactly how much that actually restricts her diet, it's overwhelming, because it's like, oh my goodness, this poor child is not going to be able to eat anything. At least is how it comes across. So it was a little intimidating, just, that she was diagnosed. It was great that she was diagnosed early, but it was, how are we going to work around this? I have an older son and he was perfectly fine. So it was just kind of having to figure out how to adjust that.
Samantha, do you want to talk a little bit about your relationship with food?
Yeah. So with being diagnosed so late, I was, eating like a normal 23-year-old at the time, and had every type of meat, had every type of, like any type of food that you can imagine I was eating. Had no idea what was wrong with my body until that genetic blood, or I can't remember they were testing me for whatever disease because I just didn't feel right. But I was like, I know everyone always asks, like, is there a food that you miss? I miss somewhat, like, the typical Chick-fil-A and things like that, because like you can't have the meat and all the other stuff that normal now 29-year-olds can have. Like it was a huge adjustment for me, actually. Even after the diagnosis, I was still trying to understand it because I wasn't given a full understanding of it. And when you're still trying to adjust, you kind of make the adjustments that you need to make, but it's hard. I went from, having a turkey and cheese sandwich every day for lunch to, oh no, you can't have that anymore. So my numbers did decrease a little bit after the year I was diagnosed, but they didn't decrease a lot. So I was trying to figure out why, and that's when I learned a lot more, that it wasn't just meat protein that I needed to get rid of, it was all protein.
Yeah, I think that's a good point, because so many people think low protein diet and they're like, oh, so like vegan or vegetarian. And if only it was that simple. There's a good podcast on that. It's, I think, called like, wait, how do you spell that? It's by, oh gosh, drawing a blank. But it's another Patient Worthy puts it out. And it's about their experience trying the low protein diet and how it was not like that one time they went vegan. So trying to go back here to my questions that I had here a little bit. So, going back to, how we interpreted the diet, that's where this was going in my mind. Amber, given that Samantha had that initial diagnosis at birth, what was your thoughts on what, it would entail versus what your experiences have been? How has that varied between, that initial information that you were given versus the reality of the situation and as she has aged?
Well, at first, like I said, it was very intimidating because there's like, okay, well, this is all the types of food you can't have. And, these things are too high. Well, then you start breaking down. Okay, yeah, meat is obviously a big one. It's one of the top ones. And then you start looking at, then there's wheat. Wheat has a lot of protein in it, especially concentrated. So that eliminates pasta, bread, peanut butter, and nuts, legumes, beans. I mean, it starts throwing all these things out that have not just protein, but other nutrients that are necessary for our body. So we can't even kind of like worm those in. So it was scary. I mean, like, I'm like, what am I going to find for her to eat? Now, as she's gotten older, it's gotten easier, simply because you do it for so long, you start to realize, okay, I can relax a little bit on this item. I can't allow her to have this. It's still hard because as they get older, they start having their own desires, their own wants. So you try to work with that, but sometimes it can be its own battle. And particularly for us in our day and age, things seem to be easier than, say, those who might have been diagnosed way before the 90s. And there's a lot more things available now that's making it easier to say, okay, I can go to the store. I can find these non-dairy cheeses now. I can find a loaf of bread that has 1 gram of protein for either per slice or per 2 slices, and not have to worry about having to order these special and super expensive items. So, I mean, almost everywhere is coming up with all different kinds of non-dairy milks and yogurts and all this stuff. It's helping tremendously, that I feel we could be more blessed to have had her at this time versus the, for those who were diagnosed long before any of this stuff was a thought.
Yeah. I know it's to think about the evolution, and, you know, I tell people all the time how much easier it is now, because we have aisles in the grocery store with gluten-free items and dairy-free items and vegan items, where, you know, in the 90s, people would have just kind of been like, what are you talking about? But now it seems like everywhere. Walmart has a pretty good selection even, and, you know, even Aldi. So things are definitely far more accessible, and slightly more affordable than their medical food counterpart, from the companies. I wanted to touch on, because I know that, Amber, you have a background with cooking in your previous life. And then Samantha, your family owns a restaurant. And so I was wondering how your backgrounds, it kind of helped shape how the impact of the diet. Amber, could you talk a little bit about that?
Sure. My background, my husband and I met in culinary school. So I actually graduated with a pastry arts degree. He graduated with a culinary arts degree. And it prepared me in such a way I would never have imagined, as far as being able to be creative and actually make my own recipes that I've been able to put out there for this community, not just Homocystinurias, but PKU and MSUD and all those other disorders that have to have similar types of diets, that I've been able to experiment and come up with these recipes that work with as many common ingredients as I can, without having to do huge amounts of rare ingredients that may never be used, or that can be used for multiple things if necessary. So it kind of helped prepare me for what seemed like God's plan. You know, it was just going in motion just to be prepared to take care of her and help the community the best way that I can.
Yeah, it's definitely one of those things, I call it the uniquely qualified, that we become. Like, you know, my background in education, I thought I was never going to use it being in the role that I am, like teaching, but in a very different way now. And so not everyone's going to have the ability to help others with homocysteine in the educational aspect. Samantha, do you feel that your family's background with their restaurant had an impact on, you know, how you were able to deal with it or adapt?
I don't know if it was more of the background of that they had, but I was able to find, like, I think I was able to see that, like, you know, I can still go out to eat and find things that I can eat. It doesn't have to be like every time we go out to eat, I don't have to eat a salad every single time. I can find something, or fries or whatever. Like, I actually just had salsaritas tonight. But I can get, I think it was, I can, they have a nutrition calculator on their app, and I can just plug in what I want and be like, okay, well, this is going to get me low into my range that I need, and I'll be fine. So I think that has helped. I mean, you know, it's kind of gotten me more prepared to, when I go out, to look at the nutrition stuff. If they have a nutrition calculator, plug in what I'm going to eat. I think that's kind of like, you know, it's changed over the last, 5 years. Some of these companies never even, or restaurants never even had a nutrition label or calculator or whatever. So it's really cool to see that, like, places are starting to adapt, not only for us, but like everyone out there.
Yeah. That actually leads very well into our next conversation about, you know, this things that have helped or things that are struggle in relationship to the diet and formula. be it, the financial, the social, the adherence, other aspects that might be overlooked. I love that you started this conversation with the social aspect, the going out to eat aspect, because so much of our lives is encompassed in going out to eat. Not only is it a convenience factor, but it's how we celebrate. We celebrate through food. And I think that's a worldwide thing. It's not just here in the United States. I mean, barbecues, family parties, graduations, 4th of July. It's everywhere. And so, I prior to COVID, our family would always pick a restaurant quarterly, and that's how we would celebrate birthdays. And it definitely made it easier when things did have a nutrition calculator, or you could view the menus online in advance just to kind of know what you're walking into. I know for myself, going out to eat has caused quite a bit of anxiety just because I don't know what's going to be available. And so when they have that menu online, it makes it so much easier, not just for those family situations, but going on work conferences. You have to eat something somewhere. And so being able to kind of scope things out in advance definitely makes it easier. I know there's definitely chains that I kind of have stuck to. Before Sweet Tomatoes went out of business, it was very sad. That was a big go-to, but now the make your own pizza type places like Mod Pizza and Blaze Pizza, those are our go-tos. And Chipotle can easily modify things without any question, because it's build your own type food. Are there outside of the food aspects, in terms of the the social aspect, or maybe you guys have more social aspects that you want to talk to? I know, Amber, your Samantha is in school, and so how have you found that transition with the diet and formula for her?
Our school's actually been very adaptive with her. They currently are going to have some new staff, so I'm going to have to work with them. Her nurse was fabulous. She made sure she got her formula every day, in which case Samantha didn't give him any trouble. But she also, before, like when it was a transition between kindergarten and first grade, the nurse already gave her first grade teacher the information. So the teacher was already aware of her condition. I still had to elaborate somewhat, but that was already done. So that was actually a wonderful thing that the nurse did for me. So I already gave the teacher a heads up. As far as lunches, most of the time, there was many days where Samantha would just have me make her lunch. Now, there are days she wanted to eat at school, so I would have to email them in the morning and say, Samantha would like a tray today. Can you please have one ready? And, then they would make sure she had something to eat that day. And there's been a few days where she left her lunchbox in the car, before she got on the bus. And so they'd have to throw something together for her. So they were good about doing that. I usually, I would say, okay, looking at the meal plan, whatever she eats has to be 2 grams or less as a serving. So I told them, rice is fine, mashed potatoes, corn. I told them, I said, I know she doesn't always eat the vegetables, but offer it to her anyway, because I really want her to start to eat those things. And so they would, if they had any concerns, they would send an email to me like, okay, we have an ice cream day. What can she have? I said, well, anything that's, popsicles are great. Those are nothing. So she always was able to indulge. Our schools don't do anything food-wise as far as in the classrooms. They don't do birthdays, so you can't bring in cupcakes or anything like that. So I've never really had to worry about that. I did have to make sure that she had a snack at school, because, we don't get the same kind of protein. She doesn't get that protein that keeps her full through lunch to keep her focused. So I always made sure she had a snack at school. so she could have, have something that would hold her over.
Yeah. So did she have formula at lunchtime or have a formula while at school? I think you said that, but
Kindergarten, she did not. When we came to first grade and they were wanting to bump her up to 2 pouches a day, we started to make her take it at school, which made it easier for us, but she still only got the 1 pouch in. Right now we are struggling so bad we can't get her to drink it, and it's just a horrible struggle. I think overall, I think it just upsets her stomach, and that's becoming an issue. Like we're good at getting her meds in, we can't get her the formula in, aside from just normal lifestyle, being busy and forgetting about it, unfortunately. When we do, if she tries to take it all at once, there's occasions where it upsets her stomach quite a bit, and it makes it difficult.
Yeah, I can attest to that. Taking the proper dose is one thing. I can usually get away with that, but the kids' doses, and I don't think some people will realize this who aren't on formula, but the pouches are the same for an adult or a child. There's not like different sizes. And so you're stuck taking the same amount, whether you're 7 or 37. And so it's a lot to take in. And because they're these raw amino acids, they do upset your stomach. And I know days where my schedule's been all kind of wonky and I have to make up for something and take a little bit more. It creates a lot of indigestion. It's terrible. And then it makes it almost, you can't really function for a while afterwards either. So I sadly can relate. It's extremely frustrating to not feel your best, especially at school, where she probably wants to, participate and do well and, just be like all the other kids. Definitely it's not easy, I think, regardless of age. Samantha, what are some of the struggles you've had with the diet and formula? I know sometimes we don't always want to share these struggles, but I think it's really important just because there's an audience outside of ourselves. And hopefully they're the ones listening that can make a difference too.
Yeah, I shouldn't say it, probably I don't have. A lot of the time I don't have a problem with the diet. There are some times where we'll go out to eat or we'll go to a barbecue or something and I'll see the meat and I'm like, I want that. I want a little bit of it, a little bit, just a little bit. It's hard to resist it, especially since I've had a taste of it. And I know what it tastes like and I know it tastes really good. As far as formula, it's gotten a little easier for me. Taking it wise, obviously it's always going to be a struggle, but it's not okay, I have to go take that now. It's more of okay, I know I need to do it. Let's go do it and get it over with. It's actually kind of funny because, Amber was talking about how Samantha takes it at school, and I'm a teacher, so I rarely take it in front of the kids because I do it at lunchtime, but there are certain occasions where I do have to eat lunch with the kids or around the kids, and they'll see me drinking it and they're like, Miss Stallings, what is that? And the first time that it happened, it was kind of around Halloween time, and I told my mom about it. I texted her and she goes, just tell them it's witch's brew. Just tell them it's witch's brew.
Sounds good to me.
And, yeah. And so I told them and they just kind of gave me they're kindergartners. But so they're like, okay, weirdo, what are you talking about? And so it's just kind of funny, but no, taking it some days, I'll either forget on purpose, because I just don't want to take it, or I will just suck it up and just drown it down and do it pretty fast. I used to make these really weird faces when taking it. All my friends would attest to it, and they're like, and now it's just kind of it's almost like I don't drink alcohol because I'm on 2 heart medications, but it's someone would take, if you were taking a shot, just downing that shot of protein down your throat and it's done.
Yeah, I totally can understand. And I have to say, so in the last, well, now it's a little bit more than 6 months, but the first 4 months of the year, I went through 4 formula transitions, and there was a reformulation of the formula I was on at the time, and the first formula. And I know when they reformulated, I really struggled. They added fish, not fish oil, but it was DHA, which tastes like fish. And I would just sit there at the sink and gag, and the faces were terrible. And my husband was like, "Is it really that bad? Is it really that bad? Come on." And I was like, "Yes,
when I first got diagnosed, my mom and my grandmother was in on it too, made a deal with me. If I had to drink it, they would taste a little bit of it just so I would even take it.
Yeah. No. And I think honestly, everyone, if you have a family member, you should try it, just so that way you understand what they're up against every day. And the truth is that you get to do this as like a one time thing, or if you try it like a 1-day diet challenge, that's a 1-day thing. But to have to do it every single day, and it's not an option, it's a have to, like there's no opting out. It's hard. It's really hard. I have to say the only thing that's gotten better is there's like more options now, but the options still aren't really great, because they all kind of, every single option still has, a con to it. And so I know I'm on formula pills, and there's a lot of pills to take. And so right now they're the best option, but the powders require a lot of prep work, but the liquids don't taste good, but they're convenient. So everything has, as many pros there are still definitely cons to them too.
I've heard when I order my formula, I order half and half, just because it just kind of whatever, either A, whatever mood I'm in, or B, like, when I'm traveling, it's easier to travel with the powder than it is the liquid.
Yeah. I wanted to also touch on the financial aspect. I'm really fortunate. I live in a state where medical formula is covered for all inborn heirs that are on the newborn screen. And so I am very, very fortunate because I've never had to pay for formula. I've looked at moving, and I'm kind of held hostage to the state, because to pay for it out of pocket, I calculated at one point, it would be like $24,000 a year if insurance didn't cover it. And even if they covered like 70%, that 30% is still incredibly expensive. And that's just formula. That's not the other medications that are required. And so there's no medical food assistance here in the state of Illinois, which is unfortunate, but at least we have the formula aspect, and I'm fortunate I have a higher protein tolerance, so I have room to kind of negotiate my protein with more things I can find in the store. Can you guys, have either of you experienced the financial aspects that are associated, and would you be willing to share kind of some of your experiences?
Yeah, Kentucky is actually one of those states that does not pay for anything for airborne metabolic disorders. I don't know if Danae, I don't know if it was you that sent it to me or someone, or I just was researching myself. They do cover some formula, but it's for esophageal disorder, some esophageal disorder. And there's also a loophole in Kentucky. If you are on private insurance, not like if your insurance covers any of it, you don't get any more help. So I had reached out to VitaFlow, that's where I get my formula from, and they had a financial assistance program. I qualified for it, and well, until this formula shortage, it was $266 for a good amount of cases. Now it's almost $400 because I guess they upped it because of the formula shortage. But my mom and I have been trying to talk with some people we know in the state legislation to try to at least get to Kentucky to pass something saying, like, this is not right for people that have airborne metabolic disorders to get left out, especially if they're on private insurance. I mean, I can't be the only one in the state of Kentucky that's on private insurance and having to deal with this.
Yeah. When you think about how many PKU people that are out there and all these other disorders, MSUD, MMA, PA, there's a lot. That's just very small. You know, you're not alone in this, and it's really unfortunate that, you know, that they'll cover this. It's really discrimination. It's like the genetic lottery. Well, I wasn't born with that, but I'm born with this. And so it's really frustrating when, you know, you're excluded from that group. Amber, do you have any experience in this realm of unfortunate?
The biggest thing is, I think Indiana is also one of those that formula has to be covered. So we've never had issues getting formula covered. So that's been one of the good things here. But the metabolic foods, that's where we talked with Renette Franco, and she's been such a help trying to get, help us understand the insurance, but also kind of take over to make sure that the proper communications are done. And she helped us helped our insurance, us understand our medical foods would be covered once our deductible was met. And then that would be covered. So then we had a period of only like a couple of months, but we could actually order a good amount of foods that we needed and have it covered by insurance. And that was a big help. Right now, excuse me, I think I'm gonna, excuse me, sorry. As a recipe developer, it gets difficult and expensive because now the only insurance we have with her is Medicaid, and that's a whole nother issue. So we're not sure that they'll even cover any medical foods at all without, any proper help or guidance there. But so when I need to develop recipes, I've been, samples we've gotten from previous conferences and things like that, I've been able to have time to play with. But overall, it gets very, very expensive to have to order things like that out of my own pocket, and to be able to help out the community and develop these recipes. That's why I do try to make the recipes where I can find things in the store, because the medical foods are difficult to find. However, wheat starch is such a big component for a lot of the things that we do, for baked goods and things like that, that I still need those kinds of things. I still need the pasta, even for Samantha to eat and things of that nature. So it just gets really pricey very quickly.
And I think going back to your thing, Danae, with you said you're able to find stuff in the grocery stores, and that's how I am too, because my protein allotment is high on the higher end. I mean, when I do go to the conferences and stuff, and obviously I take the free samples and stuff like that, and I end up liking some of the stuff, but I'm like, do I really want to forfeit up the cost if I can find something similar in like a local grocery store?
Yeah, I think that's where I always meant. It's like the protein to cost ratio. I would like to see some calculator for that, like somewhere developed, because it's really, I think that the outside world would be like, what are you talking about? But it's like, is this really worth it for how much protein is in it versus what I can find in the store? I know for myself, I'm trying to think of an example, like the low protein bread. I think that's a good example, because gluten-free bread is really low and it's much more affordable in the grocery store. So am I going to spend $10 on a loaf of bread? It's probably cheap at this point for the medical foods bread. Or am I going to spend $4 on a loaf of gluten-free? I'll spend the $4, and it might be like a half a gram more of protein, but it's worth the cost savings. And so all those kind of things, I think we have to take into consideration. It definitely gets complicated in our decision-making process of terms of protein and the affordability. I want to end here though on, just what are some things that you guys wish others understood about the diet and formula? I know there are so many things for newly diagnosed families, and being that I was entering very early adolescence when I was diagnosed, I didn't understand the importance of formula, and I was not an adherent patient. Really, really struggled well into my mid-20s until I had my blood clot. And no one ever explained what the role of formula was. They just said, take this. And at the time, it was this horrible powder formula that we mixed with, well, I mixed it with banana pudding. My brother mixed it with chocolate. It was horrible. I don't know what we were thinking. And it was a huge volume, but because I was so inadherent, it created a lot of deficiencies in terms of I wasn't getting enough protein. So that caused issues. I wasn't getting enough calories. I was severely underweight. It's kind of scary and sad looking at pictures of me as a teenager because I was a good 30 to 40 pounds underweight. And it also it affected, I have scoliosis and osteopenia, and I've had eye issues and all those things, you know, our diet plays such a huge, tremendous role in. And so I didn't understand as a teenager, like without this, you are creating more problems. It's just going to get more complicated and a lot faster. Your hair, your nails, your eyes, it's your skin. And so it just, you know, the things that we're already very aware of as a teenager, they're just amplified by poor decision making from inadherence. So I wish that someone would have sat down with me and explained some of that. Don't know if it would have made any bit of a difference, but I think it would have been helpful just to know like the cause and effect correlation. And so, and it's not just like going vegan. I wish it was that simple. Amber or Samantha, are there things that you wish people understood about the diet formula or low protein aspect?
I don't know if it's like other people, but for myself, it's one of those things that I've seen myself obviously I've seen myself get really, really high, but that was before diagnosis, but I've seen myself get on the higher level after diagnosis. It's actually this past November. I let myself slip a little and I saw my numbers get really high again, or not as high as they were, but I got really down on myself. And I think anybody in that situation, once you got your numbers down into the 30s and you let them escape all the way back up to the hundreds, it's not a fun sight to see. It's just, I wish, like, you know, there was some kind of, I don't want to say like a chart or a calculator or something that said, if you eat this much protein, your levels are going to shoot up this much. If you just go over this much of your tolerance. Just because like it's just one of those things, like some people think like, you know, oh, a little bit of meat or a little bit of actual cheese or whatever is, oh, it's not going to kill you. But in reality, it may not kill you, but it's going to make your levels go up higher, which puts cause and effect into it.
Yeah, I know. I tell people my blood clot was made of cheese. That was like the cheese and carbs, like bread, pasta. They were the downfall of my existence before my blood clot. And the thing is, it's not like a peanut allergy where you immediately see the effects. It's that slow progression. So a bite of a hamburger or a slice of cheese pizza or, you know, whatever it is, all those little things, they add up. And so it's like maybe one will not hurt. I'm not a dietitian. That's not medical advice. But if you're doing that each day, it's like it starts to really compile, and then you have a much bigger problem. And so I know for myself, I don't allow myself cheat days. I don't allow myself just a bite of something. I think that's the worst thing, especially in my case, knowing how hard it was to stop eating meat, to stop eating real cheese, to stop eating real pasta, the things I really loved, and to reintroduce those things and then, you know, have to work to de-introduce them, it would be devastating. And so I would never, ever I wouldn't recommend just a bite of anything that you're not going to be able to eat. long term, because it's tough. It's tough to go back when you're trying to clean up your messes. So I wish that too. I wish there was a way that you could correlate it better and not have to wait like a week for results, if not longer. Amber, are there things that you wish others would understand or knew?
It's very difficult to work with the low protein diet, especially with her being 7 and fully aware that she has this issue, can tell everybody about it, can fully pronounce it. And, but then she'll sit down at dinner and I'll have food for her. And there's a lot of times I try to make it as close to ours as possible. But there are some days where I'm like, okay, you have this, we're having this. Because there was no way I could, in the short time, make it so it was low enough for her to have the same thing. And she'll see we have 3 or 4 things on our plate, and she'll have 2. So now you're still having more, whether or not her volume is the same. We still have more on our plates because it's a more variety. Mm-hmm. And then it gets down to being a kid and being picky about certain foods. I don't want this, I don't want that. She needs the nutrients, but we can't get her to eat it. And the worst thing is trying to not struggle with her, because there is also risks of, other emotional aspects with this type of condition that I have read. There's some depression, some mental health concerns. So I don't want to push her to a point where any of that becomes a major issue. Mm-hmm. But like I said, formula is a struggle. I've tried them all.
Yeah,
I know what they taste like. I know why it's hard. And with them being acidic and high in amino acids and everything else, there's a lot of times where she can't keep it down, which becomes a complete backfire, because then that alone raises her homocysteine just because she's throwing up. The medicines, she needs didn't stay down. The formula she needs didn't stay down. It's, costly for it to come back up, and it's counterproductive. So I'm like, I don't know. I know she needs it, but I don't know if it's worth having her throw it up all the time just to try and get whatever she might keep down. And that's where I'm like, I couldn't stomach it myself. So trying to force my 7-year-old daughter, you have to have this, and trying to force her to take such volumes of it, I don't know that I could do it. So it's difficult for me to say you have to have this for your health, but you just have to deal with it. And it's not, I can't imagine a 7-year-old having to understand that. Yeah. Like, she's supposed to be taking 2 of those pouches. That's almost 8 ounces of fluids. And trying to shove 4.2 ounces in one quick drink, it's difficult for me. 4 ounces is a lot, not to mention with it being concentrated with medication or whatever it is. So it's a hard struggle where, okay, she needs it and she knows she needs it, but the formula is really something I wish we could get away from and just figure out some other way to get the nutrients that they need, because it's just, the formula is the most difficult part of it to me.
I think that's the other thing, is like the formula is so hard, but like as Danae was saying, she takes the tablets, but the tablets aren't much better, because the tablets are horse-sized pills, and for us patients that have to take those homocystinuria other stuff, it's a lot more. And then having it, so like I think 16 tablets equals 1 pouch. Taking 16 tablets, 2, 3, 4 times a day of those horse pills, for me, it was just my stomach couldn't handle it. I can't swallow those 16 horse pills in one sitting. I can't do it. Like, my body, I start gagging on it. It's just one of those things. It's the cost of, do you want something to taste disgusting, or do you want something that you can barely, swallow?
Mhm.
And that's the thing. It's like, and these are the choices we're stuck with until one of the companies comes up with a better solution, be it a different formula or a different therapy altogether that removes that need. I know for myself, I've the formula, as long as I don't procrastinate and have to double dose or take 1.5 doses at a time, I'm fine. But the low protein diet I find very difficult. I'm adherent, I stick to it. But when things are so beyond your control, family parties, business trips, when I remember when I was a teacher and the teacher, the parents would come in. Oh my gosh, I can't remember the term, but I was never able to participate in those things ever. And it was like, oh, why are you having some? And it's like, I don't really owe you an explanation.
And that's the other thing. So being a teacher now, like, PTO brings in stuff all the time, and it's just, and they're like, well, you can have some of this. I'm like, no, I really can't. And like, so my parents' restaurant catered one of our lunches during Teacher Appreciation Week, and they were ordering in, and my mom goes, I'm also going to give you all some fajita veggies. And they were like, no, you don't really need to do that. My mom goes, one, you got some vegetarians in your that work in your office or in your school, but also my daughter does eat those, and she will be eating those, because otherwise she'll be just having rice and beans in her taco, and she's not doing that.
Yeah. And it just seems, it's like our lives are complicated enough with the health aspects that we have to deal with, the doctor's appointments, the formula. And it's just like, I just would like things to be simpler. That's really what I want. I just want life to be simpler. And unfortunately, this is not an area I can simplify. I can find a formula that is easier. I can try to find recipes that work for my entire family. That's not always easy, as Amber has pointed out. And it stinks. But I have to say, I am very happy that we do have access. Being the executive director, I constantly am hearing from families, oh, do you have formula that we could have? Do you have cystidane? Do you have low protein food? And unfortunately, many times the answer is no, because it's so expensive. We can't just fund these things to families, although we are working on it. We are working on assistance. But we're just about out of time. And so I did want to remind people, if you have created a Rare X account, please go into your account and fill out the surveys. The one that we're discussing today, again, is the interventional or medical diet survey. It is really quick. It is literally about a minute long at most. It's just a few check boxes. And I think it's like 3. And then also the next person who messages me a picture, they can do it to me or email info@h2networkamerica.org, who has not already set up an account. Kind of have a list from people who've sent me before, but if you send me a screenshot of your dashboard, I do have a $10 Amazon gift card, and I also have a couple more Rare X Own It t-shirts left, and so we are still giving those away to those who fill it out. We are now at 33 enrollees. Only about half, though, have filled out surveys, so we need everyone to get in there, fill out those surveys. There is a publication that is being worked on, and so the more patients go in and fill out surveys, the more data we'll have to pull for that publication. It will be coming towards the end of the year, so we really need patients to get on it, and caregivers, and to fill out those surveys, because they will help us understand, being able to share the needs better of the community. And again, you can find that at homocystinuria.rare-x.org. It is also on the home screen of our website. And any last words, Amber or Samantha, before we sign off for the evening that you want to share?
I don't, not currently.
All
Not
right.
that I can think of.
Well, I think what
Hold on. I think I want to thank Amber and Danae. In my beginning of my journey, I think I reached out to you all at least 10 times a day.
We're here for.
And because I remember I was talking to Danae about something. I was like, Danae, I don't understand this recipe. She goes, it's Amber's, here's Amber's contact info. And so I immediately contacted Amber, and I just like, I can't thank you both enough for everything.
Thank you. And thank you for advocating for, even in Kentucky and everywhere else, for us.
Yeah, I think it's important for us to remember that, you know, although homocystinuria is rare, that there are a lot of us in this together. And it's not just, unfortunately, a unique situation, just a classical homocystinuria. There are a lot of other disorders that require this crazy low protein medical foods, medical formula diet. And so, you know, there is support if you need it. And HC Network America is working on a medical assistance fund to help offset some of the costs of medical foods. Unfortunately, it won't cover formula, but there are formula programs. If you are having trouble accessing your formula, please reach out to Raynette Franco. If you do not have her information, we can share that with you. It is also available on our website. And if you have not already, do reach out to your formula company, because many times there is in-house help in helping obtain coverage as well, as Samantha had mentioned earlier. So we thank all of you who have been listening in. And if you have any questions, please reach out to us at info@hcunetworkamerica.org. And thank you.